I think doing cervical screening is just uncomfortable to begin with, and it's really awkward. And for me, I think what made it better was being able to ask the clinician questions about the process or things that I should keep in mind. And I think the best experience I've had was having the clinician just ask me up front about my pronouns or how to refer to my body parts, because as she was going through the procedure, she was giving me a heads up of what she was about to do before doing a certain thing. So I found that really helpful, just knowing kind of ahead of time what to expect from that experience, and it was over in a jiffy. So it was as nice as it could be.
Going in for a cervical screening is scary for anyone. But if you see a trans and gender diverse patient, that might not be the scariest thing they'll feel that day. It is important to keep those things in mind. It's a scary experience to be vulnerable to a doctor, especially with the system we exist in as trans and gender diverse people. If you take that into consideration, you're showing respect for the experiences of trans and gender diverse people, and they're gonna feel a lot safer openly communicating with you, which is what doctors are meant to want.
When I see a clinician or nurse for a cervical screening, I want to be feeling comfortable and that I can speak my mind if I've got any concerns or questions, and also that I can change my mind or withdraw consent at any time.
So there's lots of things you can do to make yourselves more LGBTI inclusive. So the first thing is seek out LGBTI inclusion training, but check with your patients, check what pronouns they're using, ask their names, be respectful, be human, check to see what words they want to refer to their body parts as, and just keep checking in.
I think for a lot of the queer community, especially for trans and gender diverse folks, most of the medical experiences we've had are very uncomfortable and sometimes just traumatic. So I think to have somebody, a clinician who is inclusive, makes all the difference. And I think for any clinician that is looking to be more inclusive in their practice, I think one of the great places to start is to attend or be a part of inclusion trainings to help you cater to your patients better.
Having an inclusive clinician is vital in feeling safe and comfortable. If you feel like your clinician isn't accepting of your identity, you're not going to want to go get the test or go back to get follow-up tests. This is, of course, not good because this is really vital and it can save your life to get screening.
Self-collection is a really good option for lots of groups of people, particularly people who identify from the LGBTI community. Not having to have an examination is a big plus, and it's getting a lot more people through the door.
People will talk on and on about how the trans and gender diverse community is a vulnerable group, but do nothing to accommodate to that. You know that we suffer worse health outcomes. You know that we have these experiences that make life harder to live. If the least you have to do is do an inclusion training just to make the lives of trans and gender diverse people easier, do it. That's a small step for you that can mean the world of difference to a trans person accessing medical care.